Hi, I'm Maddie, and I'm a co-presenter, presentation creator, and background researcher.
I'm Megan. I'm another co-presenter, background researcher, and a business planner, and we are going to be presenting to you our Peace of Mind Planner.
Ella and Sarah, our other co-founders, were essential to our creative process by creating the layout of the planner in Canva, figuring out the design quirks to ensure accessibility, and making sure that our planner was efficient for all patients to use. Osteoporosis, fibromyalgia, reach out to your PCP, follow up with me in a week, hypothyroidism.
Now imagine trying to keep all of this straight. As an 84-year-old grandma, mom of 3, right after spending your entire 30-minute doctor's visit being diagnosed with 3 new chronic illnesses.
It's overwhelming, it's confusing, and for a lot of older adults who aren't comfortable with technology, it can feel impossible.
That's why we created the Peace of Mind Planner, inspired by our co-founders' grandma's experience. It's a simple, paper-based medical journal to help people keep track of medications, appointments, and any symptoms of their newfound diagnosis.
We're passionate about making health management less stressful for patients and families, giving back some control and, most importantly, peace of mind. Managing a chronic illness is a complex and overwhelming task, one that often involves juggling multiple doctor's appointments, medications, and follow-up plans. The reality is that managing these aspects can feel like a full-time job, and for many, it's simply too much to handle.
With this, patients often face dozens of appointments with various specialties, each requiring different preparations, documentation, and follow-up visits.
It also causes people to have multiple medications with complex instructions, making it easy to get confused about when, how, and which medication to take.
This can also lead to unclear follow-up plans that leave patients uncertain or confused about what steps to take, causing anxiety and feelings of being overwhelmed.
Fragmented information from different providers that isn't always communicated effectively can also lead to gaps in care.
All of this can lead to missed appointments, medications being taken incorrectly, forgotten questions, skipped referrals, and most importantly, a lot of stress. The issue doesn't only just affect the patients, it can also affect their families, caregivers, and their providers as well. We've all seen people in our lives struggle with managing multiple diagnoses, handling intense medication regimens, and trying to remember countless details about their care. The pressure to keep track of all of this information, both mentally and physically, is very taxing for someone.
What makes it even harder is that all of this is happening while also having miscommunication between providers, gaps in care, and overwhelmed patients who feel disconnected from their own treatment plans. We wanted to create a solution that addresses these issues, a tool that consolidates all complex information and puts it in one central location. This will make it easier for patients to manage their care, feel more in control, and ultimately reduce the stress that comes with chronic illness management for patients and their families.
Here are some major impacts that we found after doing research. The CDC estimates that 60% of adults in America have at least one chronic illness, and 40% have at least 2. 133 million Americans live with chronic conditions. Studies show that 40 to 80% of medical information is forgotten immediately after a visit, and poor care and coordination contributes to $25 to $45 billion annually in avoidable costs. Right now, many hospitals use apps like MyChart. While these do have their benefits, there is still a missing piece. Many times, the MyCharts from different doctors or hospitals do not sync up, or different places use different systems altogether. Even so, these apps do not have a place to track things like when you are taking your medications, daily symptom tracking, or places to just jot down questions that you can have for your provider at your next doctor's appointment.
Additionally, these apps aren't always the most user-friendly, especially for our aging population who might struggle to use technology sometimes. They're great for information, but they're not great for explanation of what the information means or how it might affect the patient, making it not user-friendly, especially for these older populations. Our planner will give patients a place to put that information when they receive it to look back and remind themselves of it in a way that they understand. Limitations of phone reminders and family who aren't medical experts are that the phone reminders primarily focus on medication times, but they don't capture the full scope of patient needs, such as symptom tracking, daily concerns, or emotional well-being. These patients are left without a comprehensive tool to monitor their health day to day, and our planner aims to solve that.
To counteract the issue of confusion surrounding technology and low health literacy in older adults, our team created the Peace of Mind Planner. This medical agenda was designed to have everything a patient needs in one place. This includes dates, times, locations of doctor's appointments, medication schedules, as well as daily activities. Like stated in previous slides, this is to ensure that miscommunication is limited and patients have a more organized sense of how to improve their health in the day-to-day.
This is an example of our Your Medications page. There will be many blank ones at the beginning of our planner as well, so that each time there's a medication change, the RN or the MD who's going over the new medications with you can fill out a new sheet. This will limit confusion upon discharge, keep the complex medication regimens as simple as possible, and ensure that patients are taking the correct medications, know the indications, and important information of what to watch, including precautions to take and when to take the medication.
So on this slide, we have an example of the Understanding Your Disease pages. In each of our medical planners, we'd have multiple blank pages where a patient can fill out a diagnosis, how to manage that diagnosis, any specific information related to that disease process, such as nutrition, providers in charge of that diagnosis, because for many older adults, there's a wide variety of providers, medications related to that illness, when to call and what to expect, and as well as a place for you to write down your questions during a visit or for you to go back to if you forgot a question and you're going to ask it at a later time to your doctor.
Here's an example of what our daily planner page would look like. Either a nurse could fill this out for you, or if our patients are able, they can fill this out themselves. This will have a schedule for the day, including appointments and simple to-dos like pick up prescriptions, questions that they can jot down and ask their doctors later, symptoms that they're having that day, which will be essential for providers to know later on, care team information, emergency contacts, and medications that they can check off after they've taken them to eliminate confusion about what medications have already been taken.
Here's an example of our monthly calendar pages that would be in each planner. So for each month of the year, a patient or their nurse could fill any important scheduling information needed for that month, as well as important reminders and any notes. Our team has considered getting funding through various healthcare systems or medical device companies to create and publish our planner. Initial costs would include professionally designing the planner pages, creating templates, and printing high-quality physical copies. Ideally, we would work with insurance companies and be able to offer the planner to patients through their insurance companies. Otherwise, our goal would be to keep the cost low, making the planner something that most people could afford. We would get the word out about our journal by proposing the idea to primary care providers and hospital systems. We would show them how the planner works and explain the benefits, and then they can recommend the journal to patients they think would benefit from them.
Let's think back to Shirley. Despite being diligent about her care, the systems meant to support her, like MyChart, were fragmented and overwhelming. She needed more than scattered online portals. She needed a true partner in her healthcare journey. Today, you've seen what's currently available, systems like MyChart that, while helpful, are not patient-centered enough. Then you saw our solution, the Peace of Mind Planner. This would change everything. Patients' healthcare information would be recorded for them in a simple and accessible way. It would promote open communication between patients and their healthcare teams across all specialties, and it would empower patients to be active participants in their healthcare treatment plans, improving patient outcomes and quality of life. Imagine if our co-founder's grandma had this planner, something customized for her specific needs, created not just to document her care, but to help her understand it, own it, and feel empowered every step of the way.
Our Peace of Mind planner would be nothing without the people behind it.
I'm Maddie, and I'm a people person. I pride myself on building strong relationships with patients and colleagues. I connect with others and communicate effectively, which is essential for understanding patient needs and ensuring that our planner stays user-friendly and accessible. Our co-founder, Ella, is very organized. Her attention to detail and organizational skills make her our power person for keeping everything in order. She organizes patient feedback, manages project timelines, and ensures that the team stays on track and that all aspects of our planner are systematically addressed.
Our other co-founder, Sarah, is deeply committed to improving healthcare delivery and patient outcomes. She is very passionate about healthcare management, and she drives the team to think strategically and think outside of the box when it comes to working with patients. And me, I'm Megan. I love tackling complex challenges and finding innovative solutions. I would like to think I have critical thinking skills and problem-solving skills that help the team overcome obstacles and create the best prototype that we can.
We're deeply committed to seeing the solution succeed because every patient deserves peace of mind.